Good afternoon, everyone, and welcome to our presentation titled Health Promotion for Young Families, created by Amy Doyle, Alexa Grant, Lucy Hendrickson, Lauren Landry, Tara Orman, and Taylor Walsh. Our group worked with families in vulnerable situations. Keeping with the Canadian Community Health Nursing Standards, promoting health in the populations we worked with was our main objective. We took an upstream approach in consideration with the social determinants of health. We recognized that as nursing students, we were in a position to advocate for these families. The main population we worked with were young families. Spryfield has a large percentage of single-parent families in comparison to the HRM and Nova Scotia. Single-parent families typically have lower incomes and poorer health outcomes. Lucy worked with similar families on the South Shore. Spryfield residents have a lower household income and education rates in comparison to the rest of Nova Scotia. Social determinants that may negatively impact a person's health are also described by members of the community, such as inadequate childcare, food insecurity, and the physical environment. This is a picture taken from Rockingstone School showing the community of Spryfield. Along with a windshield survey and consulting of existing demographic data, informant interviews and participant observation at Rockingstone allowed Alexa to collect data on the community. Alexa collaborated with a public health nurse and early childhood educator to help create the Early Years Junior Mentorship Program. They focused on targeting healthy childhood development through health education. Early childhood education has been shown to abate the link between low socioeconomic status and educational achievement. Alexa helped to create a program to increase participants' knowledge of healthy childhood development and childhood education. She recruited 5 junior high students to attend 10 weeks of educational sessions that culminated in 5 practical sessions in Rockingstone's Early Years Center. This is a picture of a weekly progress chart that the students filled out to help create realistic goals and responsibility. Formative evaluation included observation of the participants. Summative evaluation included the completion of activity plans and program evaluation. A positive change in the participants' practice was noted during their practicum. Lauren and Amy's population of interest was preschool children between 3 to 6 years of age. During this period of continued growth, active imagination and magical thinking are normal parts of development. At this point, preschoolers are developing their sense of identity. Care providers should encourage them to complete simple care practices to help build self-esteem. With a focus on health promotion and infection prevention, they assess the need for hand hygiene education among preschool children at the YWCA. Research shows that hand washing is the greatest significant way to prevent the spread of infection and illness. Lauren and Amy developed and implemented an interactive educational session to share the importance of hand hygiene practices with the children. They hoped to promote health by teaching hand washing as a way to prevent the spread of infection. Children have weaker immune systems and are more likely to get sick. Evaluation would need to be completed periodically over time in the hopes that a decrease in infection would be seen at the YWCA. By providing this information at a young age, they hope to decrease infection throughout the children's lives. Lucy worked alongside midwives to provide client-centered and community-based health promotion, prevention, and protection. This involved working with the population to promote physical, mental, social, and spiritual health and well-being. A midwife is a trained healthcare professional responsible for prenatal, labor, delivery, and postpartum care. Midwives provide community-based primary maternity care for healthy, low-risk women and their newborns, in collaboration with physicians, nurses, and other members of the interdisciplinary team. Lucy provided prenatal and postnatal teaching, screening and care, as well as breastfeeding support and education in the community. Access and equity were key to this clinical placement. Working with the midwives, who provide publicly funded, unbiased care, was an excellent learning experience. Lucy was able to provide optimal, client-centered, community-based care. Lucy evaluated her clinical work by using self-evaluation, evaluation discussions, and forums with the midwives. This also included engaging in a discussion with the prenatal class participants, which consisted of their thoughts, comments, likes, dislikes, and questions following the 2 prenatal classes she taught. The Volunteer Doula program provides free pre- and postnatal emotional and physical support, along with support during labor and delivery. The vulnerable populations that the program provides services to include students, teenagers, single parents, newcomers to Canada, and families with low income. Taylor and Tara started their assessment by looking at statistical data for the doula program. They found that teenagers were the least likely group to access a doula, even though teen pregnancy tends to be higher in low-income areas like Spryfield. They concluded that teenagers were unaware of the doula program and the service it provides. They contacted high schools and junior high schools in the HRM area through email and telephone conversations. They let the schools know that they were available to meet with the school to discuss the program. They also offered to send educational materials about the program to the schools. They delivered pamphlets, developed and gave presentations, and met with pregnant teenagers at different schools in HRM. In order to effectively evaluate their health promotion efforts, a year's worth of data would have been needed. Hopefully in the following year, the data will show an increase in teens accessing the program. Health promotion is a principle of primary health care. Our clinical group was able to promote health through elementary school involvement, proper hand washing, and supporting families through midwives and doulas. We had the opportunity to educate our community about resources and supports that could positively contribute to their overall health. Thank you all for taking the time to watch our presentation on health promotion for young families. We hope you found it informative and interesting.